Hi, good afternoon. My name is Dr. Sanjay Mehrotra. I'm a cardiologist. I've been working with Dr. Shetty for a long time. Of course, next to me is well-known Dr. Devi Shetty, who is the chairman and founder of Narayana Health. And we have taken this platform of introducing ourselves and taking questions from the various patients across using the internet services where we would be answering health-related questions to our patients who are all across the world through the Twitter, through the Facebook, through the YouTube, and of course through the website of Narayana Health. And who doesn't know Dr. Devi Shetty? We started working together about 11 years, 12 years ago, and everybody knows how and where we have reached.
16 years.
16 years.
Yes.
No, we started in 2001, Dr. Shetty. Yeah, so it's 16 years now. That's a long, long time. So let me ask a question to Dr. Shetty before I take questions. So, Dr. Shetty, what do you think is the economics of health in our country? Where do you think we have come from and where are we going to go?
I think we have done amazingly well, Sanjay, compared to what it was.
Right.
Like I left England in 1989.
Right.
And the first surgery I did in Calcutta, patient paid 150,000 rupees.
Right.
That comes to more than, I think, $3,000. Today, we are doing the same operation with better results for nearly half the amount. Yeah, but still, we need to do 2 million heart surgeries a year, and all the heart hospitals in the country put together perform 120,000 heart surgeries.
Yes, we all know that there is the amount of disease which we have and the amount of population we have in our country. I think we can surpass any other country on this planet. We probably will be doing the largest number of anything and everything which you can talk about. What do you think about that?
I agree with you. I mean, in terms of heart problem, we have perhaps one of the largest number of heart patients in the world because we are 3 times more vulnerable for heart disease than Europeans from Caucasians.
Yes.
We are 3 times more vulnerable. That also our patients develop heart attack at a much younger age. In England, most of my patients were retired, well settled retired people, whereas here it's the young breadwinners of the family who develop heart disease.
Yeah, I've heard you saying many times that this is a country where the old father brings a young son for the treatment for heart disease, and in our day-to-day practice, being a cardiologist, we see a lot of these young patients. You will not be surprised to know that about 25 years of age, he comes with a heart attack.
Exactly.
So, because of all this, we have these loads of questions which have come to us from various parts of the country. I think there was about 3,000 questions. So they've been sort of shortlisted. And so what we will do here today is that I would be asking certain questions, and wherever I can chip in as a cardiologist, I will help or I will answer. And I read most of the questions are directed towards the Dr. Shetty. So here's the first question, Dr. Shetty.
Sure.
This is a gentleman from, I think most likely from Bangladesh. His name is Morshidul Alam. He wants to know that what is an ASD and how you can repair this atrial septal defect.
Okay, I think I can show you a model.
Yes.
This is the model of the heart, and heart has 2 receiving chambers. This is a chamber called right atrium, and there is a chamber called left atrium. In between that, there is a wall, and if there is a hole in the wall, it is called atrial septal defect or ASD. It's a very common problem, and it can be treated without operation today. Most of the ASDs can be treated without operation, just by putting a simple device.
So this next question is pertaining to that. There is a question from a mother who is asking about for a 3-month-old baby, that she has an ASD. So, and the question is that what size of ASD can be closed by clip surgery, which I think she means the same thing, that it can be closed without an operation. Yeah. So what do you think about it, Dr. Shetty?
What's the name?
The patient mother name is written Panna, and the baby is 3-month-old.
Hi Panna, the 3-month-old child with the ASD really doesn't require intervention. you can confidently wait till the age of 3 to 4 years old, till the child becomes 3 to 4 years old. Then you can decide about various options. There are 3 options. One is if the hole is very small, we will continue to monitor it. If the hole is large, it has to be closed. Most of the ASDs, these holes can be closed without operation with the device. Child needs to stay in the hospital for just 2 days or 3 days following the procedure, and 3 months from the date of procedure, child will not be on any medications, and it is as good as curing the child. The last option is operation, depending on the size and the rims and the other associated problem. So, there are multiple options. In nutshell, do not worry, see your doctor once in 6 months, follow it up properly, and wait till the age of 3 to 4 years old.
I must add one more thing, Dr. Shetty, I think which probably is important, that we need to see that the children who have been told that they have ASD should be looked after by somebody who is an expert, and a proper echo to be done, because they may not be part of something else.
Exactly.
Which should not be ignored for the time.
I agree with you.
So suppose there is a 3-month-old baby who has a problem, it will be better to go to an expert to see, and they get an echo done, echocardiogram done to see that there is no other problem. Is that right, Dr.
I agree with you. Yeah. I think you have to consult an expert cardiologist, preferably a pediatric cardiologist. Correct.
So now we probably switch a bit, and there is a question from Mr. Nasrullah. The question is, what are the basic ways to control high blood pressure apart from medicine? And he's put in question marks, too many medicines are harmful.
I think you should answer the question, Sanjay.
That question.
Yeah.
So, the blood pressure is a disease which happens to us after a certain age. Most of the blood pressure which happens after about 40 years of age, we call it the secondary hypertension, which is now appearing earlier than expected. And it's important for a lot of people to understand this fact, that if you have high blood pressure, you should get it controlled. Because medicines are not harmful, it's harmful to leave the blood pressure uncontrolled. Because if you don't control the blood pressure, in a duration of about 10 to 15 years, all your target organs will get damaged. For example, your eyes, your brain, your heart, your kidney, all that get affected. So it's important to control the blood pressure, and I think it's important to also control the blood pressure not only by medicines, because they are important when we need them, they are important, but also important for somebody to do something called as non-drug treatment of hypertension, which includes that if you're overweight, you have to reduce your weight and come to ideal body weight. You have to reduce the intake of salt, and I actually recommend my patient not to take shelved food, because all shelved food which you buy from outside, it contains, especially these soups and the Maggies and other things, they contain a lot of salt in it, which are used as a preservative, and you should avoid them. And also salt intake should be reduced. Your diet should become rich in fruits and vegetables. You should exercise regularly, but it's very, very important you see an expert regularly. Get yourself checked, examined, get your other tests done, check your heart, check your eyes, and control the blood pressure to a normal level, which is less than 130/85. A normal ideal blood pressure is of course up to 120/80. Is that okay, Dr. Shetty?
Perfect. So you recommend that people should take medications if it is more than 130.
Yes.
What about 140?
So the treatment of blood pressure depends upon what level it is. So any blood pressure which is more than 140, 90, we call it, up to 159, 89, we call it stage 1 hypertension. And beyond that's called a stage 2 hypertension. So people with stage 1 hypertension with mild blood pressure, they may require only a single drug, and the preferred drug nowadays is either a diuretic or something called the ACE inhibitors or the ARBs. They are the preferred drugs. So as your blood pressure starts going up, we need to add drugs. Many times your blood pressure may be controlled just by reducing weight or maybe a single drug. So your blood pressure should be below 130/85, especially if you have other risk factors, for example diabetes, where the damage to the kidney is even higher. So your blood pressure has to be controlled, brought to normal, and if you bring it to normal, then you may not need a drug. But whether you bring it to normal with a drug or non-drug, it's something which depends upon what level of blood pressure you are already suffering from. And probably that may be the answer for this question. Couple of other things about blood pressure is that I find It's becoming more and more common in younger people. I find even 20 years of children now who are having blood pressure, and I think it's all to do with the inactivity, physical inactivity, increased body weight, more and more confined to homes, more and more confined to indoor activities rather than activities
Playing
outside.
with the iPad rather than football. Yeah,
absolutely. And that makes
yeah.
a difference. If you remain fit, you're outdoor person, it's very unlikely you will get blood pressure.
Sanjay, I strongly believe that somebody who's diagnosed as hypertensive, young man or a girl who's having a blood pressure 145, I think we should really ask them to change their lifestyle,
absolutely.
exercise, then
Absolutely.
meditation, yoga,
Absolutely.
at least for 3 months, 4 months.
Before we started.
Before we start.
No, I agree with that.
Yeah.
You absolutely agree with you. If, especially this group of patients who have younger people, you should avoid drugs and you should allow them to. And I think we should counsel them very properly.
Exactly.
That this is what is most important for you. And
see what happens, Sanjay. My experience is, someone who had a stressful week, with the deadlines. Today everybody is under pressure.
Absolutely.
And sleepless nights, they get headache, they go and see a GP. He says blood pressure is 150 by 90. And next thing what comes is a drug and a prescription.
No, that I agree with you.
Yeah, 30-year-old person, if they start taking these chemicals called
absolutely.
drugs, how long they going to take
But
it?
one question I would put you then, suppose he doesn't do lifestyle modification.
Then there is no other choice.
No other choice,
But they accept it based on their what they want in life.
Absolutely.
There are large number of people, Sanjay, today who are determined to work hard and avoid drugs.
Absolutely.
And we should give them a choice.
Yeah. And I think we should have a platform, and I've been talking to you about it, that we should have a platform of preventing disease.
Exactly.
And that's where I think we will grow more than anything else, I can tell you this thing.
Yes.
We need to work on this preventive aspects of all cardiovascular diseases, which is not only hypertension, but all what is linked with it. Let me go to the next question. So this is a question, Dr. Shetty, which I think probably needs some general knowledge. Name of 10 food items in farmers that will keep us away from diabetes, pressure and heart disease.
I think you should come up with the answers.
I think it's a bit difficult, but I think what I would recommend is the background which we just discussed, is that it's most important for you to have the ideal body weight. And today's problem is that you're eating too much and not burning out enough, and that's the reason you gain weight. I have a thinking that probably it boils down to having too much of simple sugars in our diet, which is causing the problem. We're eating too much, and then obviously we have most of the places we go by a automated vehicle. We don't walk enough as we used to, and we need to cut down on our calories we consume, and we have to have a right combination of food in our diet, which includes a right combination of proteins, carbohydrates, and other aspects, fat including. And I'm not against anything specific in particular, but I think it's the combination of diet. And you need to bring your weight down. So if you're overweight, you need to control your weight. So whatever food item which is increasing the weight, and it will be all sorts of high calories, for example, simple sugar, all simple sugars, fat, fried food, all will increase your weight because you're consuming too much. And also I recommend that you should avoid shelled food, which is pre-cooked, and it has trans fatty acids, it has a lot of preservatives. So it's although you can argue, may question that nothing is clean in our, in our food items, like there may be pesticide in it, but we cannot be pessimist all the time. We need to sort of use whatever is best for us, and for that matter, a diet rich in fruits and vegetables. And I also recommend that your diet should not be food should not be just yellow and white in color. It should have other colors also in it, like some green and some yellow and some vegetables. That means you have to eat a lot of vegetables and you have to exercise regularly. So as far as food is concerned, you have to reduce the load of carbohydrate in your body to refrain yourself from diabetes. You have to take a proper content of protein. Your per day requirement of protein in 1 gram per kg body weight. So if you're a 70 gram kg weight person, you need 70 grams of protein per day, which our diet, unfortunately, an Indian diet is deficient in. And especially it becomes more difficult for a vegetarian, where I recommend that you should take more and more of, protein-rich food. I don't think milk is bad, but you should not take very high fatty milk. You can take milk, especially the skim milk or semi-skim milk, a lot of chana in your food, a lot of germinated seeds in your food. You can take paneer, meat about of that milk which doesn't have fat. And of course, fruits and vegetables. And the most important thing is you have to add it with physical activity, exercise, and the ideal body weight. Food is just not the only thing which is important. There are other things to it. What do you think, Dr. Shetty?
If you ask me,
Yes.
If you want to stand on your feet for 9 hours a day,
You have to be fit.
you have to be fit.
Yeah.
Then I'll tell you what I would recommend as ideal diet, Sanjay.
Right.
Cornflakes for breakfast
Yes.
with 1 or 2 bananas.
Yes. I do that.
Okay, that will keep you going till
For the day.
1 o'clock.
Yes.
1 o'clock you should have good lunch. You shouldn't reduce your lunch
no.
because you need to work
Work
for
for the
another
day.
6 hours,
Correct,
at least
absolutely.
4 to 5 hours. So lunch is predominantly, if you are a non-vegetarian, you can have fish or chicken,
Correct.
but not curry. Curry is disaster.
Yeah, absolutely.
Indian cooking is disaster for the heart.
Agree with you.
Yeah. It's very sad. I love it, but it's not good for you.
All right.
I mean, if people eat, it's good for my business, but not good for the patient.
Absolutely.
The, the ideal diet, see, fish and chicken has oil in it.
Yeah.
So if you
Their own natural oil.
Exactly.
Yeah.
The oil itself is sufficient.
For it to
If you
cook.
barbecue or
grill it.
stir fry, grill it,
Yes.
it's sufficient.
Yes.
And one thing we miss in our diet is salad.
Correct.
I have been eating salad for the last maybe 2 years now. About 30% of my diet is salad.
Salads.
And initially I used to hate it, but now I
Started
love
liking
it.
it. Yeah.
I love it. And interestingly, Sanjay, my hemoglobin was 13 when I started eating salad. Now it is 15 with the salad. And I haven't taken any iron
Supplements,
tablets.
yeah.
And I feel lot better.
Better. Yeah.
Whenever I used to have the typical Indian curry,
Yeah.
by 4 o'clock I used to get a bloated sensation.
Correct.
Now it's gone completely.
So have you reduced your rice also?
Significantly.
Yeah.
Rice is bad news.
It's bad news. I agree with you.
Yeah.
So my recommendation is same that rice, even wheat, something. Many times I tell my patients that you should make chapati because people are used to eating mixed with something and I say you make it out of chana or besan or something other than wheat because wheat is also in large amount. Of course, you should not stop wheat, but you should. Rice is bad news for sure. And all of us are fond of eating a bit of sweet after that, and that's where again the problem comes.
See, sweet you can't avoid, but you can have a little bit. But I personally feel people past the age of 40 should take an oath that after 6 o'clock,
I will not have sweets.
I will not have sweets.
Perfect. So then the dinner is devoid of sweets. Let me go to the next one. So this is an interesting one. And it comes from Bangladesh again. Why most of the people from Bangladesh have heart disease? And I will ask you to answer this one.
I really don't think Bangladeshis are an exception. Whether you're an Indian or a Bangladeshi, your lifestyle, your diet, your taste and your approach towards life is same. We are all in the same ship.
Yes.
And I hope it is not a sinking ship. So it's very important that we have to understand that we are at risk, and as an Indian I can confidently tell you that as far as the heart is concerned, being an Indian is a risk factor.
Absolutely.
And it's not an exception for Bangladeshis. So it has nothing to do with Bangladeshi or Indian, it is our genetic predisposition plus our bad diet. And the lifestyle.
But you know, platform like this which we are on right now is an education platform, and I think the people of this country are very education and hungry to know what they can do about to change that. So that mindset is already there, existent in the population. How can I prevent it? And I think platforms like this are becoming more and more important. You know, it's very easy to now get access to information and knowledge using internet and using a device, using your phone, using your iPads. And that's where this knowledge, when it reaches to people, I'm sure the lifestyle will change.
Definitely.
And it's not far away because what used to happen in 30, 40 years now will happen in 3 to 4 years,
exactly.
5 years.
I agree.
What do you think about it?
I agree with you, Sanjay. I think the people are a lot more amenable See, how many people you see on the road, Indian road today, smoking,
No.
flashing a cigarette?
No,
You
very
rarely
less.
find people.
Very less.
And cigarette
Although
is
it's
not,
banned though.
yeah. So essentially the regulation as well as the people's attitude definitely makes a big difference.
Makes a big difference, right. So again, the next question is again similar. I'm a young man, Sonam Chaudhary, who says I'm 39 years of age. How will I be safe from cardiac disease? And I think the answer probably is similar, or you want to add something to
Exactly.
it?
See, I mean, apart from what we have always been, it's very, very important for Indians, Bangladeshis, all of us to believe that exercise is a very, very important part of feeling good, feeling healthy and living longer. That's very, very important.
I will ask one question to that. Where do we exercise?
There are, you know, if you have the desire, Sanjay, there are no
find a
excuses.
place. Yeah.
See, I can't walk on the street because early morning if I walk on the street, I will be running an outpatient in the OP on the street, right? So I have a treadmill.
Yes.
And today treadmill has enough place for you to keep the reading material.
Yes.
I keep my iPad on the treadmill.
Right.
45 minutes, I walk very, very briskly. I finish my exercise and I would have finished answering all my emails.
Right.
And when I finish my emails, I go to the news.
Right.
So essentially, when I am exercising, I am already, I finished most of my work. So
yeah.
it's not a boring job.
And this is 6-7 days a week, or you give a rest?
Every day.
Every day.
I exercise for 45 minutes every day.
And what time you get up? Let me ask a practical
I
question.
get up by 5 o'clock
5
in the
o'clock,
morning.
right,
Yeah.
right. Do you meditate, Dr. Shetty?
I don't meditate to that level, but I'm very spiritual.
Do you introspect?
I do on a
Right.
treadmill.
Yeah.
Yeah.
Okay.
Yeah. Because that's the only time I have for
what do
myself.
you do in a flight? Let me ask this personal question.
I take loads of books
Yes.
and I read it
Yeah.
and I leave it in the plane. I don't bring it back.
All right.
Because the idea was to just read it and finish it.
up.
Now with the Kindle and all kinds of
I mean,
things, I have all the materials. I finish most of my work.
Yeah, yeah.
Yeah.
So it's difficult to find. I find the time in a flight is a time of your own.
Yeah.
Many times you actually enjoy to read things on that because
Exactly.
you're not affected by phone and other things. So I wanted to ask that question for a long time from you, not for this reason, for other reasons. Let me move to the next one. So there is one question from Samantha. My mother is 58 years old and she had a bypass surgery a year back. She had 8 blocks and 2 of these were 190%. Is there any chance of her having a second heart attack in the future? Thank you. That's an awareness question.
Yeah, Samantha, isn't it?
Yes, Samantha.
Yeah, hi, Samantha. The good thing is your mother has reached the age of 59, 60 now. The coronary artery disease becomes less aggressive at this age compared to what it was when your mother was 40-year-old. One thing good about growing old, Samantha, is that as we grow older, coronary artery disease progresses very, very slow. So she's protected. Generally, only 10% of the people will require another operation in 10 years' time. So statistically, your mother is safe, but you need to see a cardiologist at regular intervals. It's very, very important. And she has to be very careful with the diet, exercise, but she doesn't need to revolve her life around the heart. I keep telling patients that this world is so exciting and interesting. There is a lot more than your heart. Enjoy your life, but know your limitations. That's all. And coronary artery disease today, with the modern intervention, medications, lifestyle changes, will allow you to celebrate life and have a good life, enjoy life, and also allow you to have a normal lifespan and a normal lifestyle. Now the restrictions we impose on you, you can't eat this, you can't do that, you have to take medications. These are important even when you do not have coronary artery disease. If you want to live a healthy life, you have to impose those restrictions.
What do you think about the stress of modern day life, of deadlines, work, long hours of work? And is it, do you think, is important? Does it affect people's mind, which ultimately affects our system?
Stress plays a very important role, Sanjay. I strongly believe in that.
Yes.
But that's the reason why I keep telling people that we can only do our best, but become spiritual. I'm not saying you should become religious.
Yeah.
You should become spiritual. The fact that you believe in the presence of God, that there is someone up there making sure that everything happens the way it should be,
Right.
making sure that we are protected, can be a very strong stabilizing force. And the second thing is, never look for perfection. We bring in lot of tension to ourselves by putting very high standards. World is designed by the God not to be perfect. There is nothing like a perfect wife or a perfect husband or a perfect son or a perfect job.
True.
We have to live to accept the world as it is than what it should be. Like I'll give a simple example. I always think, okay, if my wife was a little bit more tolerant, if my wife was like this, my life would have been better.
No.
Without realizing that my wife is also thinking the same thing about me. So
I don't know.
my suggestion,
Let's not
Sanjay,
bring that right now.
my suggestion is, Sanjay, if I can tell my wife that you're not okay, I'm not okay, that's okay.
That's okay. You know, many times you feel that the good is the enemy of better. And I think probably we can have one more session on spirituality, which I'm also very keen to sort of talk about, but I think that's on a different platform. We'll probably talk about one day. Let's go to the next question. And this is a question by Anu Dubey. Tips for good heart health after bypass surgery.
First of all, Anu, I want you to understand that bypass grafting or an angioplasty is not like something, I have a problem, I paid money, I got it fixed, now let me get back to my life. It doesn't work like that. This is just the beginning of a long journey, but very fruitful journey for you to lead a very comfortable life. So whatever advice we have given about diet, lifestyle, exercise, if you follow it, there will not be any problem. There are patients who come to us 10 years after surgery, proudly saying that, doc, I am doing fine, I stopped all the medications.
Yes.
I am looking great. That is a disaster. You can never change your medications or stop it without consulting the doctors. Because these medications, they may look like a tiny tablet, but believe me, they are very, very powerful. They can save your life. So essentially, follow the instruction by the doctors and do everything what we are trying to say, with some limitations, of course. Once in a while you can afford to fool around. Once in a while you can afford to eat whatever you want, but not on a daily basis.
True. So we move to a different question now, which probably not pertaining to what we're talking about. It's more to do with arrhythmia. Arrhythmias are abnormal beatings of the heart, and there's a question on that basis. I'm 44 years of age and patient of arrhythmia. Arrhythmia may be cured by something called as radio frequency ablation. What is the success and risk of RFA? I'll be proud if you give a proper guideline. And this is asked by Debashish Mandal from Sonarpur, Kolkata.
I think, Sanjay, you should answer
so I will
that
answer
question.
This question.
Yeah.
So the arrhythmias are basically those arrhythmias which are in the form of sudden increase in your heart beating, palpitation, are many times caused by these extra electrical circuits in our heart. Our heart has electricity which spreads from one point to another point, and that is what causes the beating or stimulation of the heart by which it beats. This electrical activity many times doesn't go through the normal path. It doesn't go through the normal electrical wiring, and there are extra paths. And the radio frequency ablation is nothing but we tend to sort of locate these paths. You may have seen people who, in our olden times, these electricians used to come and put one bulb here and wire there to map it. So we do mapping like that to find out where they are, and we burn these pathways, and that is what is called as radio frequency ablation. This is done by experts, although all of us know about it, but it is not done by us. There is a group of expert in our hospital, for example, and they are called as electrophysiologists, and they are the people who do it, and we have all the facilities, and I'm sure not only here, many other centers in the country have these facilities, and it's a very well performed, good treatment. If I can say that this is the curative treatment, once you take care of that, your heart is devoid of that. This is the only cure possible in heart ailments. What do you think, Dr.
Yeah,
Shetty?
that's the beauty of electrophysiology study, radio frequency ablation, EPS. These are some of the conditions by intervention you can cure the patient. There are not many conditions on the heart where you can confidently say that I can cure you. These are some of the curable conditions, but you need to see the experts.
Right. So this question is from Khalid Arafat. Is there any other option except angioplasty and bypass surgery to remove heart block? I will answer it. I'll ask you to answer this one.
See, for any blockage, first line of treatment is medical line of treatment. You have to change your lifestyle, put him on medication, provided the blockage is not very critical or it is not located in a critical area of the heart. So the first primary aim is to manage it without operation, without angioplasty. But if the doctors feel that it is located in a very critical zone, then you should go for a lesser intervention procedure called angioplasty. But if it is affecting all the three arteries in multiple locations, then you have no choice, you have to go for a bypass. So this decision, you can take it in discussion with your cardiologist.
I must add to that many times stable coronary artery disease, which is say in a 70-year-old gentleman who walks a bit, about say 2 kilometers, he gets a bit of angina and then he sits and then he walks again. And this has remained like the pattern for a long, long time. Interventions may not help very much.
Exactly.
A lot of these people are quite okay with medical treatment, which means drugs. And one should not get panicked that you are told today that you have such kind of disease and you will die or something will happen. Usually doesn't happen in a stable patient, but yes, those who become unstable, who have suffered a heart attack yesterday or in the last few weeks, and they have critical blockages all across the system, and they are younger, where there is a risk to life, they should be definitely treated. They cannot be left alone just on medical treatment. Right.
I agree. You see, you read the angiogram report in a piece of paper saying 80% blockage, 90% blockage, and then you get sleepless night. So everything depends on where the blockage is, what's the age of the patient, what's the quality of the blockage, because a lot of the smooth blockages doesn't cause problem, it can be left alone.
Yes.
So it's very, very important that this decision is taken by experts, and the most of the time, good number of the time, these blockages may not require any intervention.
Right. So we move to a different area, I think, which is quite close to us in this hospital about babies. And there's a question by Daniel. My baby is 3 years old. He's becoming blue while crying in nails and ears. What should we do?
If Daniel, if the baby is getting blue on crying, you have to see a pediatric cardiologist at the earliest. They should do an echocardiogram. And most of these blue babies require a surgical intervention. And it's very, very important. And you can't delay it anymore. It should have been done earlier. So without any delay, you have to see the doctors, and if required, surgery is the best treatment option.
Correct. So now it's a question from a medical student, Deepti, who's asking a question. Is DNA responsible for any types of heart disease, and how much?
I think you should answer, Sanjay.
So there are certain genetic predispositions to heart disease, and there are genetic associations. For example, we can call it that the cardiac disease, coronary artery disease, atherosclerosis, or hypertension is probably more common if our parents had it, but it's probably modifiable still. And I think it's more to do with how they lived and how you can change that living. Because all of us acquire the certain habits of our parents naturally because we live with them. But there are certain conditions, for example, a hypertrophic cardiomyopathy, where the thickness of muscle, it can be transmitted. So it needs to be seen what kind of disease you have, and if there is a genetic predisposition, then one has to be informed about it. The parental guidance should be given about what can happen to their children. And of course, there are conditions which can be transmitted through our genes as well, but not all of them. So the next question is again, in stenting, bypass surgery better if done earlier than later? I think it's probably a similar question asked from Ariful Manan. Is stenting bar bypass surgery better if done earlier than later?
Any intervention should, if required, should be done soon. nothing will be gained by wait. If the doctor says stenting has to be done, or if the doctor says bypass has to be done, there is no point in waiting. But if the blockage is amenable for medical treatment, then there is there is no harm in waiting for at least a year. So we can review the situation at the end of the year.
So I think we probably have some more time. Do we have some more time, or we can 5 minutes? Okay, let's quickly go. So one more question, Dr. Shetty, here is, when I'm walking to go, and this is Biswajit Chakrabarti from, most likely from West Bengal, when I'm walking to go for my office or any near destination, I'm feeling pain in my left side, and at that time I have to stop walking and it goes away. So is this a reason for worry, and is this a heart problem?
Definitely. I think I wouldn't say you need to be worried, but you have to see a cardiologist, and you should undergo an echocardiogram and a treadmill or a high-speed CT scan. Today, high-speed CT scans can predict blockages even when it is very, very early stage. They can predict the heart attack at least 10 years ahead. So these tools are available without any delay. If you are getting pain on exertion which gets relieved on resting, you have to see a cardiologist at the earliest.
One more question which is pertaining to a general information. How common is congenital heart disease in India, and is there any way to decrease the incidence?
1 out of 140 children born anywhere in the world has a heart problem. You can't help it. It is like a manufacturing defect. But if the mother is old when she is giving birth to baby, then there is a higher incidence. Consanguinity again leads to increased incidence of congenital heart disease. So avoid marrying relatives like cousins. Then if the mother develops rubella, the German measles in the first trimester, then the baby can be born with a congenital heart problem. So these are the few things which can be done, but on the whole, there is no way you can protect against the congenital heart disease, but you can detect it when the baby is still in the womb. Major cardiac abnormality can be detected by doing a fetal echocardiogram.
I will just, this is the last question, and I think we probably will end the session then. I'm a Bikram Biswas. I'm a 28-year-old and I have a VSD, which is a ventricular septal defect. Is there any way to cure it myself?
Bikram, everything depends on the size of the VSD. If the VSD is very small, it won't bother you, you don't have to worry. But if the VSD is large, you have to get it treated. It doesn't mean if the large VSD requires operation, it can be closed with the device. There are multiple choices available today. You can use any one of them.
So that brings to an end to this session.
Sanjay, I have a message to give it to people.
Sure, that's what I'm coming to you.
Yeah, okay.
I wanted to give you, I would probably ask you to give your pearls of wisdom about you've been associated with cardiology and cardiac disease for more than
30 years now.
30 years.
yes.
So what's your advice and words of wisdom?
Sanjay, I want every Indian, every Asian to undergo a preventive checkup past the age of 40 at least once a year. Sorry, at least once in 2 years, past the age of 40. It's very, very important for everyone to understand that a fit, young, healthy male or a woman, they don't develop a heart attack, because most good number of our patients suffer from silent ischemia. You always hear of people who just drop down dead, who have been very active. So all this can be detected by a preventive checkup or so-called executive checkup. Now, why is it important that you need to undergo these tests? Why is it important? People do ask me, why do I have to not smoke, not drink, or eat whatever I want? And frequently they quote somebody who led a very, very bad life and they celebrated 95th birthday. So I just want to give an example why it is important for all of us to modify our lifestyle is because, I'll give an example about, say, not an exact figure, I'm just quoting for comparison, about say 25% of the people of the world or the Asia irrespective of what lifestyle modification they do, they develop a heart attack. They are the ones with a genetic predisposition. There are families where no male member has celebrated the 50th birthday. So they are vulnerable. So there is nothing we can do to help them, but we can help them to at least postpone it. There is another approximately 25% of the people, they can smoke like a chimney, drink like a fish, nothing ever happens to them. Only way they will die, Sanjay, you have to shoot them down. But there is another 50% of the population, approximately, not exactly the 50%, they are the fence sitters.
Right.
If they change their lifestyle, if they lead a regulated life, take care of their body, they will celebrate at least 65th, 70th birthday without a major disaster.
Correct. Correct.
But if they indulge, they land up in trouble at the age of 40, 45.
Yeah.
But who belongs to which category? Nobody knows. So my only advice for all of you is that assume that you are the fence sitter and lead a regulated life, refrain from smoking and indulgence and all the rest of it, and you can celebrate life. That is my message.
One addition I will do to this. There are a set of people who have never done anything and they fall sick. So they come and ask, what should I do?
Yes.
I did everything good in my life and still I got this heart attack. I'd give them an answer. That if you would have done it, you would have had it 10 years earlier.
Exactly. Yes, exactly, Sanjay. Yes.
So thank you very much for Dr. Shetty, and I think we come to an end, and probably we'll continue this this kind of question and answer session using the webinar and the NH dialogues, and probably see you again. Thank you very much.
Thanks, Sanjay. Thank you very much. Thank you very much for the wonderful team we have who have done a great job. Thank you.
Was good.